guys, welcome to my channel. If you are new here, my name is Dr. Tosin and I'm a GP trainee based in London. I'm currently doing my A&E rotation and I thought it would be interesting to show you guys what a night shift is like at A&E. My shift begins at 8 p.m, so I wake up at 6 p.m. in order to shower, get dressed, make my coffee and my smoothie. I left my house at 7 p.m. and took the bus to work. This was my second night shift of 3, and as I was not particularly feeling productive, I sat on the bus, relaxed, and prepared myself for the shift ahead. I got to the hospital at 7:50, so I had 10 minutes to change into my scrubs and get all the stuff I needed for my shift. I am working in resus today, so I'll try and show you as much as I can, but obviously I can't show you every single thing because of patient confidentiality reasons, but I will do my best to take you guys along with me. I hope you guys enjoy the vlog, so make sure you like, make sure you subscribe. As soon as I entered the shop floor, I was asked to see a blue light patient with an ETA of 8 minutes. A blue light patients are patients who are being transferred by ambulance with a blue light to hospital. These patients are critically unwell and require urgent medical attention. The blue light patient was a middle-aged man presenting with PR bleeding. Once the patient arrived, I took a systematic approach using an ABCDE system to review the patient. I took bloods, did an ABG, performed a PR examination and started the patient on fluids. Once the patient was stable, I referred the patient to surgical doctors and completed my notes. After seeing another 2 patients, I went for my break. As I did not have enough time to make a meal for my shift, I washed my hands and made myself a cup of tea and toast. I also was able to catch up with one of my favourite colleagues. It's been a very stressful day.
Oh my god.
Yes, how are you finding it?
I am so tired. You can see my face. Oh my god.
Yeah, me too.
This is not my real face in case, you know, I'm normally prim and proper, but I'm so tired. I don't even care.
It's been
been
so busy.
Like, I resumed at 10 o'clock. And this is the first time like I'm just resting. I just had to come and drink water.
Yeah.
And I'm also having reflux, so you know, I'm tired.
Yes. Yeah. So yesterday we went UCC and UCC was so busy. There was about, is it a 3 or 4 hour wait?
Today was 5.
And today's 5, yeah. So there's a 5 hour wait in UCC today. I've been in resus most of the time. I think it's around 3:16 in the morning. I don't know if you guys can see that. So it's around 3:16. It's been a very busy day so far and I've been in resuscitation, so it's been quite stressful. But I've managed to get a few minutes to just have a quick chat with you about what's been happening. So today I'm doing an 8 to 6 shift. So I start at 8 p.m. and I finish at 6 a.m. There's another shift which starts at 10 and then finishes at 8 in the morning. In terms of night shift in A&E, there's normally less doctors in the department. So we have 6 doctors today working in A&E during the night shift. We've got a registrar who basically is in charge of the whole department. We've got 2 doctors and majors, 2 doctors in UCC, and there's a float doctor who can help out in areas which become more busy. So today I'm working in resuscitation and it's been very, very busy. I've seen 3 patients so far presenting with different complaints. The first patient I saw was a patient who came in with PR bleeding. He was also hypotensive and tachycardic, so he was in shock. So we had to make sure that we got IV access immediately in order to give him some fluid resuscitation. And then after we resuscitated him, we were able to identify where the bleeding was coming from and referred him to the surgeons. The second patient was a patient who is known to have cancer, terminal cancer, and he previously had chemotherapy. He came in because he was more breathless than normal. He also had a productive cough. So the main thing that we were worried for him was neutropenic sepsis. So when a patient comes in with sepsis, we need to make sure that the patient is managed very quickly in order to improve their outcome. The most important thing in terms of sepsis is trying to get antibiotics within the first hour of their presentation, because it's been shown by many studies that the quicker the antibiotic is given, the better the outcome. So that was one of the things we needed to do. So for him, we obviously got some IV access, took some bloods from him, took some blood cultures, gave him some IV fluids because he was also hypertensive, and we gave him the antibiotics and some oxygen. We also had to insert a catheter inside as well in order to monitor his urine output. The third patient I saw was a chest pain patient. So it was a young gentleman who came in with sudden onset chest pain. So with that kind of presentation, the main thing we worried about was a pneumothorax. So we got a chest X-ray, and luckily the X-ray was fine. So we had to find other reasons for him having breathlessness. And in that age group, another thing that you're worried about is a PE, which is basically when there's a clot in one of the pulmonary artery, which can result in less oxygen going through the lungs into the bloodstream and into the tissues of the body.
So after seeing those 3 patients in resus, I was asked to go to UCC in order to reduce the waiting time. One of my patients was still waiting for blood results, so I had to hand over this patient to a colleague. I managed to finish my shift on time and I left the hospital at 6 AM. So that was my night shift in A&E, guys. I hope you guys enjoyed it. If you liked the video, please give it a big thumbs up and subscribe if you haven't already done so. Thank you.